Good day everyone, my name is Ayessa Camille A. Dumile. So today I will be performing the parenteral drug administration. So it includes the intradermal injection, subcutaneous injection, and the intramuscular injection. So first, let me define to you what is parenteral drug administration. So it indicates the non-oral means of administration but is generally interpreted as relating to directly injecting directly into the body by passing the skin and mucous membranes. So the first thing that I will do is the intradermal injection. So intradermal injection, it is administered into the dermis, just below the epidermis, and the ID injection has the longest absorption time among all the parenteral routes, and this type of injection is used for sensitivity tests such as tuberculosis, allergy, and local anesthesia tests. So before performing the intradermal injection, first consider the or check the physician's order. So we will check it out. Okay, so after checking, we will assess the patient's history. So we will assess the patient's history of allergic, and we will note for the substances the patient is allergic to, and also the normal allergic response or reactions. So the next thing that we will do is sanitize our hand. So I will be using alcohol. So it is important to perform hand hygiene to prevent the transmission of microorganisms. So next thing to do is we will assemble the equipments that we will be using. So I will be using the sterile water for injection, the ampicillin, the 2 aspirating needles, dry cotton balls here, and 2 5 ml syringes, and 1 tuberculin syringe. So after that, we will follow the 5 rights, which is the right drug, the right patient, the right dose, the right time, and the right route for administration. So the next thing that we will do is we will pick up the syringe, 1 tuberculin syringe, and 1 aspirating needle. So after picking it up, we will change the needle of the tuberculin into the aspirating needle gauge 25. So we will secure it and we will change into gauge. So here it is. And next thing to do is we will verify the facts on the medication ticket according to the physician's order. Okay, so after verifying the facts, we will get the drug from the medication box. So we will get the ampicillin, and then after getting it, we will wash our hands again, and we will prepare for withdrawing the prescribed amount or the prescribed dosage of the prescribed medicine according to the medication ticket. So we will withdraw So after withdrawing, we'll put the cup in, and then we will change the um, we will change another aspirating needle because it is not advisable, or it is prohibited to use the the needle that we already used on withdrawing the medicine. So we will change it. Gauge 25 also. So here it is, the new one. So next thing to do is we will put it on the tray, and we will gather all the equipments that we will be bringing to the patient's bedside, and then we will present the prepared equipments to the CI or to the head nurse. So after that, we will now carry the tray on the bedside of the patient. So next, so I've already provide privacy to the patient. I've already washed my hands, and the next thing that I will do is I will identify my patient. I will confirm the identity of my patient by asking his or her name, or reading the name of the person on the wrist, on her wristband. So my patient. So I will introduce myself first to my patient. So good day, ma'am. My name is Ayessa Camille Dumile. So today I will be your student nurse, and I will be performing the intradermal injection. So the so your name is Lorna Lopez. Okay. So ma'am, I will be as what I have said earlier, I will be performing the intradermal injection. So I will be first skin testing. I perform skin testing to identify whether if you are allergic to that drug or not. Okay? Okay. So she said yes. She agreed to me what I will be doing. So after that, we will locate the site that we will be putting the needle or putting the injection. So we will check if the site is free from edema or any scratches, wounds. Okay, so it seems that the site is safe, or it is okay to administer the injection. So next is we will clean the site. So by cleaning the site, we will start on the center outward. So, and then we will discard the cotton, and then we will let it dry. So assuming that the that the alcohol is already dry. So next is we will grab the injection, and then we will uncup, and then we will put our non-dominant hand, and then we will stretch the skin of the patient, and then we will inject. So make sure that the bevel is facing upward, and the angle must be 5 or 15 degree angle. So it is parallel to the hand of the patient. So after administering, we draw the needle, and then put a dry cotton and put a gentle pressure on it. Okay. And then encircle the wheel. So we will encircle the wheel. So after encircling the wheel, we will instruct the patient or the watcher that do not rub, do not scratch, or do not massage the wheel, because it will being contaminated, and it will result to infection. So after that is we will note the time. We will note the time of administration, and then the due time, and then the route, or the site rather, of the intradermal injection that we have already administered on the medication. We will write it on the medication ticket. Okay. So after that is we will assist the patient. So let me show it to you that there's no scratch at all. So here it is there. Okay, so after that, we will assist the patient on a comfortable position. So ma'am, so are you comfortable with that position? Okay. So thank you for your cooperation, and just don't scratch, don't rub, or don't massage the wheel, okay? Okay. So next is we will turn back the ticket to inform the head nurse or the CI that the scan testing is already through, and we will request or accompanies the physicians to read the result after 30 minutes. Okay. So that is the intradermal injection. So next is we will be performing the subcutaneous injection. So same as the intradermal injection, we will check the physician's order, we will check the history, we will patient's history, we will wash our hands, and then we will cleanses, and we will be um, arranging rather the equipments that we will be using. So in subcutaneous injection, it is a shot that is given to the fat layer between the skin and the muscle. So on this procedure, we will be injecting to the site which it could be on the deltoid muscle, on the lateral part of your thigh, on your lower back, or in your abdomen. So this time I will be using the deltoid muscle. So this is the arm of my patient. So this site is this part is deltoid, the deltoid muscle. I mean, no, it is not deltoid. It is the upper arm, which this is. So the upper arm of the patient will be this area. We will be administering the drug. So we will be using another tuberculin syringe. So we will, as if it is another drug. So we will clean the sterile area with the alcohol, and we will discard and we will let it dry. Sorry, I've touched the so we will let it dry. So assuming that it is already dry, so we will put the syringe, and we will withdraw the exact dosage. So after that, we will pin. Cup. And then we will change the needle into gauge 25. So here it is. So next thing to do is we will put it on the tray, and then we will use alcohol and the dry cotton balls. So next thing to do is we will locate the site. So this is the site that we will be injecting, which is the upper arm of the patient, and then we will first clean it. So again, on the by cleaning it, we will be starting on the center and then inward. And then we will let it dry. So assuming that it is already dry, so in administering this in subcutaneous, we will be needing that our non-dominant hand, we will grasp the fatty portion. We will grasp like this, and then we will uncup the needle, and we will administering it in a 45-degree angle. So 45-degree, insert the needle, and okay, so that's it. So we will discard the used needles, and then after discarding, we will put a little pressure in here. Okay, so after that, we will note again. We will note the time of administration, the site, the time due, the physician who read the result, and then we will put back the medication on the medication box. So we will put it back. So after that, we will put the used equipments on the trash bin. Okay, so that's the subcutaneous injection. So next thing to do is the intramuscular injection. So I will just put it here back again. So the intramuscular injection, it is a technique used to deliver a medication deep into the muscle, and the site that you can administer the intramuscular injection is on the deltoid, on the vastus lateralis of the thigh, and then on the ventrogluteal of the hip, and the dorsogluteal of the buttocks. So same as to the intradermal and the subcutaneous, we will check the physician's order. We will verify, we will assess the patient's history of allergic drugs or allergic substances, and then we will assemble our equipments. So we will assemble it, the needle, the drug, we will get the medication on the medicine on the medication box, and then we will perform hand hygiene, and then after that we will withdraw the prescribed amount that is indicated on in our medication ticket according to our doctor. And then we will change the needle onto gauge 25. Okay, so oh my god. Okay, so here it is. So next thing to do is we will withdraw. So we will put so we will withdraw the prescribed amount. Okay, so after that we will put the cup and we'll put it on the tray. And then after that is we will present it to the head nurse or onto the CI if our prepared equipment is okay or is approved to use. So here it is. And then next thing to do is we will bring it onto the bedside of the patient. So assuming that I already here on the bedside of my patient, and then next is I will identify my patient's identity. I will check for the identity of my patient by asking his or her name or reading the name on her or his wristband. So my patient is Miss Lorna Lopez. So I will be introducing myself, and then I will explain the procedure that I will be doing. So, hello ma'am, my name is Ayessa Camille Dumile. I am your student nurse for today, and I will be doing the intramuscular injection. So, I will be injecting on the deltoid, on your deltoid muscle, and it will be it is not you don't need to spend more time on it because maybe 1 minute we already finished the intramuscular injection. So okay, she agreed to me what I will be doing to her, and next is we will identify the site. I will be checking the site. So we will be injecting the drug on the deltoid muscle. So here it is the deltoid muscle. So we will be checking for the site if there's any bruises or any um, or any scratches that is being present. So we will evaluate, and after evaluating we will clean it. So wait a second. Okay, so we'll be cleaning it with the dry cotton and the alcohol. So by center on the outward rather, and then after that we'll discard the cotton, and then we will let it dry, and then assuming that it is already dry, so we will uncup the needle, and then we will position the needle into 90-degree because it is the prescribed amount of or prescribed angle on the intramuscular injection. So here, so we will put the needle, so we will put our dominant hand here, and then we will release. Okay, after that we will put a light pressure on it by a dry cotton. Okay, and then we will put the cup for the safety, and then we will assist the patient into a comfortable position. So ma'am, is it okay that this is your position? Okay, thank you. So thank you also for your cooperation, and stay healthy. So after that, we will gather all the used equipments, and we will discard it. And we will gather all the medicine because we will be putting it on the medication box after, and then we will note for the date of injection, amount, and site, and the route of administration. So after that, we will return the medicine and the medication box. So that's all. So that is the parenteral drug administration. So thank you for watching.